So now we're going to talk a little bit about managing personal problems and personnel problems. This could get interesting. So it says, how can a manager deal fairly with employees who fail to meet established standards of care? Most of the time, a new graduate nurse will not be expected to handle people problems alone. However, being aware of problems is critical, and a new graduate, such as you, must think about how to relate to such situations, including what the responsibilities are for reporting and following up in each situation. So here's a few problems that we'll see. Absenteeism, where people are out and they're calling in, they're absent a lot. This actually puts a stress on the unit. And think about how you would feel if people had called out in your busy unit, you're getting admissions and discharges, and this person is calling out, and they call out more than once or twice within a 3-month period. And look at the stress that it puts on everyone. And so we do need those individuals to help us stay abreast of our patient care. Also, someone being uncooperative, unproductive, and very immature, it breaks down the teamwork, it breaks down the camaraderie on the unit, it causes strife, it causes stress. And so these are a few of the problems that we'll see. On the next slide, there's some more. And here's some more personal and personnel problems that you may see. Clinical incompetence, someone's just not very good, or they haven't practiced in a while, they don't know what they're doing, but they like to think they do, or want everybody to think that they do, and they actually put the patients in harm's way. Emotional problems, chemical dependency, which is a biggie, and incivility. When we look at the absenteeism, it does, like I said, create that stress. And so it can lead to people becoming in conflict because someone's always being called out, then the other people's are stressed out, and then they start bickering amongst themselves. Again, decreasing morale, increased absences among staff. Everybody says, well, if they're going to do it, I'm going to do it, because nothing ever happens to them. And you have a snowball effect. And then the big thing is patient safety issues. Making sure that we have the staff in place to help take care of these individuals. Motivation is going to refer to attempting to determine the cause of a problem and working to provide a positive, upbeat environment that's going to be conducive to employees being motivated. If they're not motivated, they're not going to cooperate, and they're not going to be productive. Ability can be identified by frequent errors in judgment or technique that indicate that they do have a lack of knowledge, skill, or critical thinking. And this, again, it becomes a safety issue. Specific behaviors or trends in behaviors can also help to identify where additional training might be needed, and support is going to be needed to help them to improve their skills, whether it's communication or if it's in skills themselves. Then you have the immature employees. They become defiant. They start, testing the waters, the guidelines, seeing what they can get away with. I'm going on a break, and they disappear. And each time they disappear, they're gone longer, and they're out socializing and so forth. Passivity and hostility, they don't care. So what? Who cares? That type of attitude, and creating that little chip on the shoulder. Negative judgments can also actually, not help the situation at all, and actually becomes a very negative unit. It's important to confront the employees with the behaviors that are inappropriate. It's vital that you set limits and consequences for certain behaviors. Look at exercise 4.2. A nurse comes to you, the nurse leader, and states that one of the other nurses is tying a knot in the air vent with a pigtail of a nasogastric tube. This nurse does not know how to approach the employee to discuss the problem. What would you do? So what would you do if there's incompetence? Someone actually does not know what to do and how to take care of a patient or use the equipment. So think about that. How would you handle this? When we think about chemical dependency, patient care at this time is going to be in jeopardy when a nurse has a chemical dependency. They need to recognize it, they need to admit to it, they need to be approached, and let them know that there is help. So we tell them that they can go to treatment or get fired. And then if it's suspected, the manager must intervene to ensure patient safety. And so they will set up some type of assistant programs, which we'll talk about on the next slide. So with the assisted programs, the nurse is not the therapist. They need to send them to therapy and to get help. We need to contact HR, and because there is certain limitations in acts and policies that have to be followed along, such as the American with Disabilities Act. And we need to also talk to the Employee Assistance Program. One of the issues that we see is many times people don't want to say anything because they're afraid someone's going to lose their job. If they go through the steps that are needed, they will hold a space for them. However, if it's a chemical dependency with drugs, there at the unit, they will not be allowed to give out those drugs. Someone else will have to give out the narcotics. If they repeatedly do this again, then they will lose their jobs. Then we see people with emotional problems, and we do see this. And lots of times we look for those certain behaviors, such as the ones that we just mentioned: poor judgment, increased errors, as they say, increased absenteeism, decreased productivity, negative attitude. A lot of times this leads up to some type of emotional problem that our patients are going through. And so we do need to have this addressed and get them help. It's just as if they have a physical illness, but they just have this illness that is actually more mental. Incivility or lateral violence, this is that disruptive behavior or communication that's going to create a great negativity in the work environment and actually will start to interfere with the type of care and safety that we want for our patients. We do see some lateral violence between nurses, unfortunately, and I always assume this is a lot of that where nurses eat their own. And we'll talk about a little bit more about this in class. So how do we clarify roles? Well, first of all, you always want to give an oral reminder. Just go up and say something. Make sure they know the policies and procedures, and that everyone is accountable. Then what we can do is give a written and oral reminders. This is a statement of the problem and goals that the manager and the employee do finally agree upon. So when we look at these, this way we have a clear understanding of what are the expectations for that unit, for that employee, between them and their manager. Then they have what they call the day of decision. So this is the day off with pay to arrive at a decision about future action, what's going to happen. Pay is given, so it is not interpreted as a punishment. That is not what we're looking for. However, if they do not go within the guidelines and the standards that were set, then that is when termination can happen. Progressive discipline, this can happen either with chemical dependencies, but also with bad behaviors, things that are happening. So what will be happening is they will be counseled. Then there may be a reprimand. Then they may, whatever that reprimand be, something a little bit smaller. If that doesn't work, then they'll be suspended from work. And then to be allowed to come back, they have certain guidelines that they have to follow along. So those stipulations that are written out. If the problem still occurs after that, then there is termination. Here's the kicker, and where some things and people can slip through the system, is a lack of documentation. So documentation is vitally important. It cannot be left up to memory. You need to take notes. Have a discussion of what is helpful, particularly with employees who would report to the new nurse. have discussions of these events with the nurse or the nurse manager. Always document the date and the time that it happened, who was involved, and then give just straight to the point description of what happened, and then any kind of notations about intervention or any kind of help that was given along the way or suggestions. So again, document, document, document. And that is it.